On behalf of Finlandia Foundation National, I'm welcoming you all to today's presentation. Today, we will be talking about health benefits of sauna and showing that löyly is not dangerous. The short introduction of our presenter, Hans Hägglund. First, Hans is calling in from Sweden. So I want to thank him first for joining us this late hour. Hans is a medical doctor and professor at Uppsala University. He has a strong research background in clinical research within medicine. He graduated from Karolinska Institutet in Sweden and did his postdoc at Fred Hutchinson Cancer Research Center in Seattle, USA. Between 2013 and 18, he served as the director of the Cancer Center at Uppsala University Hospital, and currently Hans holds a position as the National Cancer Coordinator at the Swedish Association of Local Authorities and Regions, and is affiliated researcher at Stockholm School of Economics. But even more importantly, in addition to his professional background, Hans serves as the sauna doctor at the Swedish Sauna Academy. In 2018, he was one of the leading persons in the organization committee for the 17th International Sauna Congress in Haparanda, Tornio, in Sweden. And his book, The Sauna Book, Hot Facts on Sauna and Health, was released in 2020. It's only in Swedish language, I think, but we are eagerly waiting for the translation. Hans, welcome, and the floor is yours.
Okay, thank you, Anne-Marie, and thank you very much for inviting me and for giving this lecture. It's my actually favorite topic, sauna and health. And today I'm, as you said, in Stockholm. It's evening here now, 10 a little bit after 10 in the evening. So it's dark and it's a lot of snow actually. It came snow last week, and also all the lakes are frozen, and it's very beautiful. I just recently came back from the gym and sauna, today's sauna session. So let me see here now if I can change slide. I don't see. Okay, perfect. So I've been interested in this topic for more than almost 20 years. And one of the first paper I read was from Kaupinen, and it was very interesting because this paper was on facts and fables about sauna and health. And when you're taking your sauna bath, there's a lot of different histories, if it's good or bad. And it's a lot of, actually, as we spoke before this lecture, a lot of misunderstanding. And I will also honestly say that at least in Sweden, the knowledge about the effects of passive heat therapy is very limited in the healthcare sector. So if you go to the physician or the general practitioner or to the surgeon or wherever you go within the healthcare sector, the knowledge about the effect of sauna on health is limited. And as you can see here in the abstract, I totally agree with the conclusion. It says here that in summary, sauna baths are well tolerated and pose no risk to healthy people from infancy to old age, including healthy women in their uncomplicated pregnancy. The normal sauna bath with moderate cool-off phases increases the cardiac workload about as much as a brisk walk. And the conclusion here I really like. As a rule of thumb, if a person can walk into a sauna, he or she can walk out of it. And I really agree, and it still is true, I think. And when traveling around, I try to find a sauna bath wherever I go. And I took this picture when I visiting my father in Spain, and as you can see here, there are they are mentioned a lot of contraindication for going into the sauna. It's mentioned hypertension, high blood pressure, a problem with the heart, and so forth. So I'm showing this because there are a lot of misunderstanding, and that's why I actually try to give those talks to try to describe what is really in the literature. And this is my book, Bastuboken, and it's only released in the Swedish language. And we were happy to organize the International Sauna Association 17th Congress in Haparanda and Tornio in 2018. And this was organized by the Swedish Sauna Academy in collaboration with ESA. And the next Congress is held in Stuttgart this year in October, and the Congress is held every 4th year. When we organized this Congress, we divided the topics in 3 main areas. One was on health, and the other one was on history and culture, and the third was on technical aspects and architecture. And at this meeting, there were approximately 200 delegates from more than 20 different countries. The book have got great attention so far, at least in Sweden, and it has been mentioned several times in TV and on radio and on different web meetings, and also in newspapers. So there is something here with sauna and health that attracts a lot of people. And as you can see down here on the right-hand side, it has always been very successful for the company that sell sauna stoves. Here is Harvia, the Finnish company, and the paper here said that it's hotter than ever. Harvia stock went up 200% last year. So it's popular now, and I think and heard it's always also more popular in US than before, and I'm quite sure that it will be even more popular with time. So there is several studies performed on life satisfaction and happiness within the different European countries. And here are 2 reports. One from Eurostat that look at living condition in Europe, and the other one is a World Happiness Report. And if you look at the first report here, you can see that this is from 2018, and you can see that the Finns actually have the highest quality of life in Europe, together with Belgium, the Netherlands, and Austria. 76% of the people reported that they have been happy in the last 4 weeks. The average in Europe is actually 62%, and Sweden are close to 62%. So there is something here in Finland. And the other report from UN, this is from 2021, and with different questions, actually, Finland has been ranked as the most happy country, or the people living in Finland has ranked as most happy the last 4 years, actually. And you can always ask, why is Finland so happy? And here it says it's not because of the weather, and for sure it's not only because of sauna bathing, but I think, you know, the culture around sauna bathing, when you get together, it's of importance, but also the talk in the sauna and everything around it, I think, is one part of the reason why Finns actually have a really good quality of life. One of my major interests is prevention of disease, because the best medication is to prevent a disease. We know that today more than 90% of all cardiovascular diseases can be prevented. And in Sweden, 30% of all cancer can be prevented. In Europe, 40%, and globally 50%. And how can we prevent cardiovascular disease? How can we prevent cancer? How can we prevent diabetes? Well, we usually look at 4 different areas. One is for sure tobacco, smoking. And the other one that has not get that great attention is alcohol, and food for sure, and also physical activity. The interesting thing here is, I think that in Europe, each country actually put 97% of their healthcare budget on the people that are sick. It's good that you focus on sick people, but only 3% of a healthcare budget in Europe are on prevention. I think it's important now that we try to put more money into prevention. If we can prevent disease, we can save lives. We can increase the quality of life, and it's also cost effective. In Sweden, the cost of healthcare is around 50 billion euro. It's almost 50 billion dollar, and 6 million is put on cardiovascular disease annually. And Jari Laukkanen's group showed in one of his first paper that if you go into the sauna regularly, there is a reduction of cardiovascular death with 50%. And think of a small country as Sweden. If you go into the sauna 4 to 7 days a week and reduce cardiovascular death with 50%, you can save a lot of money. And the most common reason for mortality in Sweden 2016 is non-communicable diseases such as cardiovascular disease and cancer. And I now hope, and I trying to convince the Swedish government to put more money in prevention. This is not new. As you can see here, this paper is from 1939, and it says here that, do you want to be healthy and strong? Bathe sauna. And this was a knowledge that was, even known in the 30s. And at this time, the hygiene was bad, and one reason to be more healthy, to decrease the number of infections, was to go in to bathe and bathe sauna. If we go back in history, Hippocrates, the father of medicine, he used bathing as one method as a treatment method. And the Greeks have a huge public bath BC, 500 BC, and the Roman Empire, they have a lot of big swimming pools and bathing facilities. And also the Byzantine Empire had their hammam, and it's probably so that the Vikings went to Constantinople or Istanbul for different reasons, but they explored and found those hammams and went back to the north of the Nordic countries and or to the Nordic countries and created a sauna culture. But no one really actually exactly know how the sauna culture was established in the Nordic countries. It could also be so that it was influence from Russia, but what we know is that probably have people, since we were able to create fire, we also have been able to warm stones and warm rooms with the stones. So probably one kind of sauna bathing has been going on for several years. What is stated, at least here in Sweden, is that there was a bathing ban in the early 1700s, and this is probably true. It was probably so that there was local regulations, and they closed actually a lot of bathing facilities, and this was due to the fact that a disease called syphilis, which was very common at this time, was spread in the sauna, and to prevent the transmission of syphilis, a lot of bathing houses was closed. And this was actually through when the AIDS epidemic, when the AIDS started, the HIV, the spread of HIV in the 80s in Sweden as well. A lot of sauna clubs at that time was closed, and it was forbidden to have those bathing communities. And it was also so that if there were people going to those clubs, it could be so that they were have to go to prison, actually. So yeah. So in the 1700s, it was very common that people went to health springs and different watering places for treatment of different diseases. And around 1800, it was popular that go to cold bath houses and taking sea baths in Sweden. And in the end of 1800, the first warm bath houses was opened. And today there's a renaissance for sauna and those cold bath houses. And we talk about balneology and balneotherapy. And balneology is the science of the therapeutic use of baths, where balneotherapy is a method of treating diseases by bathing. And there was a lot of balneologists in Sweden in the 1800 and 1900, and they considered hygiene as important as medicine. But there is no activity among balneologists in Sweden today, but there are departments of balneology in South Europe and usually in East Europe, like Turkey, Poland, Hungary, and Serbia. Here are some pictures from different cold bath houses. You can see one here, and this is from South Sweden, a city called Malmö. Ribersborgsbadet, which is very popular, with one department for gentlemen and one for ladies. And there's another cool bath house on the west coast in Varberg. And today it's very popular to build new bath houses as well. On the lower side here, you can see a cool bath house in Helsingborg called Pålsjöbadet. And those are very popular places. In Helsingborg, there are several thousand people go to those houses during, for example, Christmas Eve to meet and have a sauna and then go into the lake. So this is in the south and west part of southwest part of Sweden. It doesn't look like this in the northern part. It's more wooden fired saunas in the north. So the bath doctors in Sweden, they have their glories mid to end 1800, and they were attractive SPAs at that time, and there was a reduced activity around the First World War, and after that, more modern outdoor baths were more popular. So those cool bath houses, they either burnt down or the wind took them, and they disappeared after the Second World War. But now today, winter bathing culture has been much more popular again. One reason is those sauna assemblies. And a new generation, much younger people, they have found those cool bath houses very popular. And if, for example, here in Stockholm, there are young people that now try to build a cool bath house in central part of Stockholm. And even smaller saunas on sauna boats are very popular. And there are one, for example, close to my house here, and they have more than 500 members, and there is only a very tiny sauna. And one of my colleagues in Uppsala, Carolina Viel, she defended her thesis 2018, and she looked at how we actually used bathing for better hygiene. And in Sweden during 1920 to 1949, there were more than 10,000 saunas built. Just this was in the cities, but it was also on the countryside. And the reason was that enhance or stimulate the people to better hygiene and by that preventing diseases. So sweating has been a part of treatment for prevention and treatment for diseases for a long time. And the sauna is also called the poor people's pharmacy. And this was used as primary care clinics in Sweden and in Finland and probably in other countries as well. And different treatments in the sauna was given. For example, cupping, bloodletting, because at that time they thought that the fluids were imbalanced in the body. So it was good to take blood out of the body. And there were also a place where child was birthed and life shroud was taking place. Here's a picture from Finland in 1930, where you can see an older woman doing this cupping on a person. And this is still, there are still some cupping places actually in Finland even today. And here are some clay figures from the sauna museum in Kukkolaforsen in north part of Sweden, where you can see a woman giving birth and also a dead man here getting this shroud. And actually happens in the sauna? What are the body's reaction in the heat, in passive heat? What first happens when you're sitting in the sauna is that there is an increased core and skin temperature, and the body aim to balance the temperature. All the organs and cells in the body works best when it's around 37.5 degrees. So the body try to reduce this increased core temperature. What happens is that there are a lot of receptors in the skin, and those receptors, they will send signals to the brain, and there is a center in the brain that regulate the core temperature. And what first happens is that those signals tells the blood vessel to dilate, to become bigger, and by that the warm the increased temperature can actually release from the body. But there is also signals to a couple of millions sweat glands. So that is actually what we can feel, an increased sweating. And when the sweat leaves the skin, it takes the heat away from the body. And since the peripheral blood vessels getting dilated, the heart will increase, the heart rate will increase, and you can actually feel that in the sauna as well. Beside sweating, also increased heart rate and increased breathing. And there are other things happening also in the body. There is a lot of release of different hormones and different substances like heat shock proteins that will affect the body. So why is it good to take this sauna? Well, as I mentioned in my first slide, it can be compared with an exercise session, actually. There is a release of endorphins. This is a hormone that reduces pain, but it's also a release of oxytocin, serotonin, and prolactin, different hormones that can actually create happiness. You use serotonin, for example, to treat depression. And there is also a relaxing and a pleasure feeling going into the sauna. And as I mentioned in the early part of the talk also, there's a social community. And usually there are very interesting conversation in the sauna. And usually also the sauna is located in a beautiful environment, in the woods, close to a lake. I think one important thing is actually the nudity. Well, naked, we are all equal. You don't know if it's a pharmacist or a teacher or a doctor. We are all equal without our clothes. And I think also one important thing today is that it's a total digital free zone. You have to leave your cell phone or computer or whatever it is outside the sauna. You can really focus on being into a conversation and support. So when I started to read about this, I used some. I searched in the literature, and searching at, for example, PubMed, a database where you can find different publications on health and sauna, for example. I found between 2015 and 2019 approximately 500 publications in English as if you heard Risto said that before this talk, that a lot of research have been done in Germany, and also in Russia, but those are not translated. So those 500, they are in English. And what we can see is that it has been an increased number the most recent years. And one important person here is Jari Laukkanen, a Finnish cardiologist, professor, and researcher. His group has done a fantastic work when it comes to study sauna, and I will come into that soon. And you can see here that the most research active countries have been Finland, Japan, and United States. And it's a lot on the most common research areas has been cardiovascular disease, physiology, and also hormone and sport. So Laukkanen, they have performed or used a study called the Finnish ischemic heart disease risk factor study. And this was done during the 80s. And in the study, there were more, it was almost 3,000 men included. They were between 42 and 60 years. And what is interesting with this study, at the inclusion during the 80s, 2,327 of those men, they completed questionnaire on sauna habits. And among those men, they took 2.1 bath per week. They stayed in the sauna for approximately 14 minutes per bath. And it was around 80 degrees Celsius. And Jari Laukkanen's group used those questionnaires and then divided the men in 3 groups. One group that went into the sauna once a week. The second group went into the sauna 2 to 3 times per week. And the third group went into the sauna 4 to 7 times a week. And then he have been very smart. He have linked those results to different national registries. And I will show you some results from those studies. He been looking, or the group have been looking to cardiovascular disease, dementia, hypertonia, pulmonary disease, stroke, psychiatric disease, venous thromboembolism, and cancer. And start to look at the cardiovascular disease. In Sweden and in the Nordic countries, it is, and actually in the West world, the most common cause of death. Also cancer has become a more common cause, and in some countries, actually, cancer today is more common reason for death than cardiovascular disease. But when getting elderly, there is also a risk for heart failure. Approximately 10% of people 80 or elderly have heart failure, which means that there is decreased pump function, dyspnea, fatigue, edema of the legs. And this also, we can see that there's an increased incidence with aging. Why I mention heart failure is that a lot of physicians actually tell their patient that they should not go into the sauna if they have heart failure. And we have showed actually it's complete the opposite. The literature shows actually that it's good to go into the sauna if you have heart failure, because actually the heart failure the symptom is actually improved. So that's one recommendation. And this is used in Japan actually as treatment for heart failure in combination with different drugs. The first study that was published by Laukkanen was on cardiovascular disease. And here he used this group with 4 to 7 sessions per week and compared with 1 session per week. And they found that there were less risk for sudden death. There were less risk for death caused by coronary disease, and there were less risk for death caused by cardiovascular disease in the men that went into the sauna 4 to 7 sessions a week compared to 1. And they found that there was a reduced risk with 51% for that group for sudden death and 45% for fatal cardiovascular disease. And think about a medication that could reduce the risk with 50%. I mean, this is enormously potent. So they then went into looking into Alzheimer's disease, and they found that the group that went into the sauna 4 to 7 sessions a week, they also have a lower risk for dementia and Alzheimer's disease. And this was reduced up to 65%. And even though they adjusted for physical activity, socioeconomical status, it was still 65% reduced risk for getting dementia and Alzheimer's disease. And then they looked at high blood pressure, and they also found here a 47% reduced risk for hypertonia. And they looked at pulmonary disease and found that there was a reduced risk with approximately 40% for different pulmonary disease, asthma, chronic obstructive pulmonary disease, and also pulmonary infections. And they looked at stroke. And in this study, it was also women included, and they found that there was a 62% reduced risk when bathing 4 to 7 times a week. And they looked at psychiatric diseases, and this was there was a reduced risk for psychosis with almost 80% in the group that went into the sauna frequently. And also venous thromboembolism was reduced, both deep venous thrombosis in the legs and pulmonary embolism. But this was found in the group that was actually bathing 2 to 3 times a week, 23% reduced risk. But they couldn't find any reduced risk of cancer. But why? What are the possible explanation for those very high reduced risk of the different diseases? Well, one important factor is that there is a reduced blood pressure, and they have also looked at the vessels, the blood vessels after a sauna bath, and found that they were more elastic after a sauna session. And when getting older, actually the vessels getting less elastic. So it's very good that they are more elastic. And this is what happens actually when you're exercising as well. And there was positive effect when they looked in the inner side of the vessels. So it was a positive effect on the endothelial. And the different studies has also showed that there are reduced blood lipids and reduced inflammation, and a positive effect on the autonomic nervous system. And the release of heat shock proteins could also have a preventive effect. Some studies have showed that there is a better blood glucose control, but this is still controversial. Some shows better, some shows no changes. So there are different reasons why sauna is good, but there are also some problems for sure, and one is that the stones are warm, and it could cause and also the löyle is hot, so it could cause burns. And in Finland, burns are happen in 7 out of 100,000 inhabitants, and this translates to approximately 350 patients annually. And 1 out of 4 burns that goes to hospital in Finland, they are due to sauna or sauna bathing. And those burns are more common they are more superficial when it comes from hot air. And researchers have looked into those burns and found that approximately 80% are male, and the majority of those that comes into the hospital were intoxicated or have alcohol in the blood. And they also found that there was an increased risk of severe burns and increased mortality compared with non-sauna related burns. So that's one important thing for the physicians to know, that if there is a burn related to sauna, it could be more severe. But it has also been, sauna has also been used in sports. Paavo Nurmi, for example, and very successful runner. He took 5 gold medals during the Olympic Games in Paris 1924, and he was sauna bathing through these Olympic Games. And he claimed, and a lot of people said, that one reason why he was so successful was because he was so frequently into the sauna. And Sweden had a great wrestler in the Olympic Games in LA in 1932, and he took 2 gold medals. And after the first gold medal, when he should enter the stage to get the medal, he was disappeared. He was not at the stage, and they tried to find him, and they were looking all over the place, and they found him in the sauna. And he was in the sauna because the next game was in the lower weight class. So he tried to lose weight, and he was successful, and he won that wrestling game as well. Today, it's more used for warming up as a rehabilitation procedure, a preparation for a sport event, but usually in different sports for weight reduction, and also for accelerated recovery. Some studies have shown that it's when you do cardio training and combine with sauna, it could prolong the time to exhaustion. So it could be good to actually combine sauna with cardio training. And there is also, I have to plug in my cord here because I think my battery runs out. So 1 second. So now I'm back again. So I remember when I was younger and went to the gym, and the first question here when I studied and went to this gym and I was trying to become a member, I asked them, do you have a sauna? And they said, no, when you go into the gym, you don't need a sauna. We don't have a sauna here. And then I was thinking why, and then 30 years later I moved back to the same place, and I went to the same gym and was asking for a membership, and I asked them if they now have a sauna. No. If you would like to build muscles, you should not go into the sauna. And now there are several actually papers that shows in the opposite direction. If you heat up a muscle, it actually increases the muscle strength. There are some studies that have looked into the muscle strength, but also they have also done computer tomography and can see that actually the muscles getting bigger if you go into the sauna after the gym session. A lot of questions are raised about how should you do with the kids. And children actually have larger body area compared to adults. And they also have an ability of sweat. The ability of sweating is not fully developed. It happens around puberty. And they have a risk for low blood pressure. But in Finland, they have performed different studies, and the one study shows that if the kid is 3 months or older, they can stay at least 3 minutes without problem. And another study shows that they can stay from, if they are 2 years or older, they can stay 10 minutes. So, the experience is that children usually follow their parents from very early age, and there is usually not any problems, and there's not a contraindication to bring the kid into the sauna, but you should be careful. You should always be, it should be supervised by an adult. The kid should be on the lower bench in the sauna, and not, you should listen to your kid and ask them if they feel well or so, because of what I said in the upper part of this slide, but there's no contraindication. How is it with death in sauna? There are several studies actually looking into this, and there's not an increased risk of dying in the sauna compared to outside the sauna. But if you die in the sauna, cardiovascular disease is a common cause of death, but it's not more common compared with that outside the sauna. And the death in sauna are usually, the people are usually intoxicated with alcohol. Some studies shows that 9 out of 10 people actually have that died in the sauna was intoxicated with alcohol. It has, as we all know now, it has been very depressing with this COVID infection in many ways. For sauna users, it has been a tough time, I think. It has been different effects of the pandemia. Jari Laukkanen and Lassi Likanen published this paper, and as we know, there was a lot of regulation and closures to shared sauna facilities during this time. And if it was right or wrong, I'm not sure actually. But according to this paper, 23% reduced or stopped sauna bathing. But some people actually bathed more frequently, depended on if they had a good access to sauna. I think now we're getting back to more normal, which is good, and the sauna facilities are open up again. This study is important in many ways. It compares cardiovascular or exercise with bathing, warm hot tub or sauna bathing. Oh, sorry. And what you can see here is that a lot of effects, cardiorespiratory fitness effects, are similar for exercise and bathing. And this is also true for vascular health. There are similar effects, and also for cardiometabolic health. And since it seems that the effect of the body are very similar with exercise, I have been proposed that sauna should be prescribed by physicians. And today it's possible to prescribe medicines, it's possible to prescribe different treatments, and also in Sweden and Norway, physical activity. And in Hufvudstadsbladet, December 2021, I was interviewed and said that I think in the future that sauna bathing will be prescribed, because today we prescribe physical activity and it's very similar effect on the body. So why shouldn't we do that? And sauna bathing could be used as treatment of diseases in combination with medications, for example. But it could also be one important way to prevent diseases. And as I started out with, it is important that we prevent diseases. So sauna in combination with physical activity is for sure a good way to prevent diseases. I found this very interesting a couple of weeks ago, and today it's possible, what I understand, to prescribe visits to the nature in Canada. And here a prescription could be of 2 hours a week and at least 20 minutes at a time. So I think there are many things that we are focused on: tobacco, alcohol, food, and physical activity. But we could also think broader and include nature, as they do in Canada, or sauna bathing in the future, and other things. I think nice architecture, music, or other cultural events that make us feel happy and so forth. So I will conclude this, and we know that sauna bathing is good for the hygiene. It's a wellness. It's also fellowship, and studies shows that there is also connected with improved quality of life. It reduces the risk for cardiovascular death. It's improved. We can see improved cardiac function in patients with heart failure. It's also a reduced risk of develop high blood pressure, stroke, dementia, pulmonary disease, psychosis, and venous thromboembolism. And it also have an anti-inflammatory effect. There are some effects also, but here there are not that many studies on this so far, on different inflammatory diseases like rheumatological diseases, or even non-inflammatory diseases like fibromyalgia. And it has also been shown that there is some effect on milder depression, chronic fatigue, and anxiety, and also on headache, mainly on headache of tension type. And some studies have shown that it could prevent common colds. I would say there is no risk for children if you supervise them, and there is no risk for pregnant females or fertile persons. But the sauna should be used with some care when you are on different medications. And one medication that you should be careful with is if you have adhesive plaster or insulin, because this is taken up via the skin. And since the blood circulation is increased in the skin, you can have increased concentration of insulin. Or, for example, if you have a plaster with different drugs like morphine or so it could be too much. So what are the contraindications? When should you not go into the sauna? One is if you have an ongoing infection, or if you have fever, because if you have fever, you cannot, the brain cannot control the heat in a normal way. And there are some diseases on aorta, and if you have an unstable angina pectoris, or if you have had a recent acute myocardial infarction, you should wait for a couple of weeks. But there's very weak there's not that many studies. The evidence is pretty weak, but that's what we are saying until we know better. And there are also some high-risk pregnancies that you should avoid sauna, and you should not combine sauna with alcohol. But still, there are many questions. We should remember that among those 500 studies or more today, they are compared to other diseases or others areas. There are few studies on sauna and health. They are usually small. They are not randomized. There's no control group, but it shows positive health effects for sure, and better quality of life. But I think there are still very many questions to be solved. One is, can illness and/or diseases be prevented by sauna bathing? Can we cure diseases by sauna bathing? Can sick leave and cost for that be reduced by sauna bathing? Can cost for healthcare be reduced if we can prevent diseases with sauna bathing? In the future, there are many studies that has to be done when it comes to cardiovascular disease, cancer, psychiatry, and in the geriatric population and sports. But the challenges is that there are no standardized protocols. So when I went through the literature, it was almost 100 different protocols used. It could be different temperatures, it could be different humidity, it could be different minutes the person stayed in the sauna, it could be different number of bathing procedures, and so forth. And there is also lack of information to the general public and hospital staff. And this has to be enhanced, I think. And also, I think now it's important to inform the officials and politicians that actually preventing disease is of importance. One major challenge is that it's very hard to get funding for doing the research when it comes to sauna. There are a few companies that work with within the field, and it's hard to get money for doing those wellness studies. It's much easier if you compare to different drugs, for example. I think that, and I hope that will be changed, and it will be easier to get funding for doing those important studies. So I stop here, and I will be happy to try to answer questions from the chat. I have not been able to follow the chat, so maybe we can, I stop here and then we can have a discussion.
Yeah,
thank you.
Thank you, Hans. This was very eye-opening. And first thing that I have to say, I have been, I guess, too long in this country, in the United States. I'm coming up with the disclaimer. So, so if you have any medical conditions, please ask your doctor before you start going to sauna 7 days a week or 4 days a week. It is important. So that's just my little.
Yeah. That's very good, Anne-Marie. The problem is that the physician doesn't know the answer.
I know, but it's just a general disclaimer that I have to say. Anyways, let's go down. If anybody has questions, you can unmute yourself and just ask or raise your hand, and we will call you. So Eric from Canada was saying the mines in Northern Ontario regularly tested miners' blood levels for heavy metal absorption. The Finns had almost no contamination due to daily sauna sweating out the skin. I think that's an interesting tidbit.
Yeah, it has been some not very many studies. We know that a lot of heavy metals and salts are within the sweat. So it could be one way of getting rid of those heavy metals. But we have other effective ways to do that with the liver, with the urine, and so forth. So it's not, there's no convincing studies actually that has shown that sauna could be used for this purpose. So because a lot of private clinics, they try to sell sauna bathing as a way to clean your body from poisoning. And I would say that there is not very many. The evidence for that is low, actually.
Then Jeremy Wasser was saying that I had a cupping session at Kotiharyu public sauna in Helsinki. It was a wet cupping procedure that also involves some bloodletting. Yeah. Very interesting experience.
I haven't done that by myself, but as I know that there is cupping in Finland, and this is an old tradition. As I said, when the medicine man or the people that dealt with sick people thought it was imbalance with the fluids. So I think this is not what I should recommend actually, because it's as he said here, it's also involves some bloodletting, and usually they what they do is that they take a knife and make scars in the skin and then put this cupping over the scar, and I haven't seen anything in the literature that says that this is an effective method actually.
Yeah.
If I could, hi,
Yep.
This is Jeremy Wasser here. I'm a professor of physiology at Texas A&M University and a big sauna fan. And among my areas of expertise are cardiovascular, respiratory physiology, and temperature regulation. I'm not a humoralist. I did the cupping because I also teach history of medicine, and I teach about bloodletting quite a bit. I also teach about sauna and both folkloric and modern ideas about sauna and health. And I had the opportunity to do this wet cupping, and I decided I would do it simply to have the experience. But I had no expectation that it would provide any health benefit, other than, as I said, a general feeling of goodness. Little fatigue, which is to be expected after 400 milliliters of blood loss. But as I said, for me, it was a positive experience. But I'm not suggesting to anyone that I went into this procedure expecting it to be beneficial. I'm Western trained scientist, and don't believe in Galenic medicine anymore.
But it was
you also had another question here. Is there a reference for an elevation in heat shock proteins after sauna exposure?
Yeah, Jeremy, we can change emails and I can send you those.
Okay, I can put mine in the chat if that would work for you, Dr.
Yes,
Hägglund.
yes, that's perfect.
Excellent, thank you very much. I'm familiar with quite a bit of the literature you discussed, but I've also worked with heat shock proteins, not in relation to sauna. So I was very curious about that particular study.
Yeah, I would send you, yes.
Thank you.
Frank Eld, you have raised your hand, so turn on your camera and...
Okay, yeah, I have a question, Doctor. In looking at the studies that you brought up on the screen, they say, well, 1 sauna a week or 4 to 7 saunas a week. And I'm not sure whether this is the meaning of it, but the implication is, geez, if you don't take 4 or 7, there's no use of taking any, and I'm so I don't know. I'd like you to kind of fill in the blanks. What if I take 2 a week or maybe 3 a week?
No, that's a really good question. And you can also, I mean, if you go in, they try to compensate for different socioeconomical factors, you know, other diseases, training and so forth. But as I think, I mean, if you go into the sauna 4 to 7 times a week, then you probably don't have, you might be a less stressed person. You might be a person that doing more, you know, eat more healthy food and exercise more. So it's hard. It could be, you know, a lot of other reasons why these groups perform so much better, but they try to compensate for those in the statistics. But anyway, they could also find that 2 to 3 times a week was better than 1 time a week. And the reason why they chose 1, 2 to 3, and 4 and more was that there were very few that actually that never went into the sauna, and they have the 1 session a week as a normal control group. But they found effect, but that's not significantly better going in 2 to 3 times a week. But I agree. I mean, it's almost for the majority, it's almost impossible to sauna bathe 4 or more times a week. I agree.
Yeah.
Regarding the sessions, there's a question: if you have 3 sauna sessions of 15 minutes each in one evening, is that 1 session or 3 sessions?
It's one. According to this, it's 1 session.
It's a 1 session. Okay.
Yeah. But if you look into the literature, this is a good question, because I was trying to say is that there's no standardized protocols, and I think within the International Sauna Association and the meeting in Stuttgart, I hope that we can get together and try to find standardization so we can compare different studies.
Then there's a question. I wonder if the heat from hot baths have the same positive effects as sauna.
There are not that many studies on hot tubs, but so I don't think no one can answer that question. But the passive heat therapy, the effect of it is, I mean, increased core temperature and the regulation of that, and also the effect of increased core temperature. So I think it might be similar effects, but there are limited number of sauna studies, and there are even fewer studies when it comes to hot tubs. So there are no clear answer on that question.
Then David December is asking Dr. Hägglund, what temperature and how many minutes for each session should someone be in the sauna 4 to 7 days per week to experience these benefits?
Yeah, well, those, I think first you should go into the sauna and you know, it should be a positive experience, and I don't think you should count that, you know, minutes, or you should not count how many times per week or so. But there were only in one of those studies that shows that if you were in the sauna more than 20 minutes or more, it was more effective than less. But the other studies couldn't find any clear cut off. So there's no answer on how many minutes, but you should be more relaxed, I think, and just feel feel it as a good experience.
Kathy Daniels is asking, has the concern regarding low blood pressure in the sauna been covered? She didn't remember hearing about that in your presentation.
Well, there are one study from the Laukanen group that shows that it has a positive effect on hypertension, but there are several studies when it comes to high blood pressure and hypertonia with positive effects. There are also meta-analysis when they have put together several studies looking at this, and it's clear that it reduces the blood pressure.
Any live questions coming in? I keep reading the chat, but if anybody has anything to say, just come up. Oh, Frank.
Yeah, there's a couple. Oops. Excuse me, Frank. One question.
Yeah.
I guess because it's hump day here, middle of the week, heading into the weekend, there's a couple questions about that alcohol commentary. So I don't know, Naomi, if you want to ask it live or just expand on that a little, because
yes, hi. It's almost in the middle of the night here, so I won't show my face, but thank you so much for the amazing presentation. And alcohol I'm coming from the US, in a sauna here in Finland was a shocking sight for me. And to see your data, I wanted to ask you why it's not prohibited in sauna, even during break sessions between the sittings, if we know that it can be quite dangerous. Thank you.
Yeah, thank you. It's a good question. Well, the effect of alcohol, it could be that, you behave in a bad way, but it could also cause hypotension. It's also arrhythmia, and it's also easier to fall. So there are and fainting. So there are several reasons why you should not combine alcohol and sauna bathing. But I think, with limitations, I find myself, one beer, it's nice to take if you a light beer, and I don't know about totally if that's possible to totally forbid, because there is a lot of, there's also a lot of culture that you should, it's drinking with how should I say this in the right way, well, if you can regulate your drinking, let's say one beer, for example, it's not, I would say it's not dangerous. So it's a good question, but I'm not personally for a total forbidden, but you should be very careful if you combine.
This is Karen Ba. Just to follow up on that, would it be safe to say, Hans, that the studies that have been done, probably, if they were done with people taking a Finnish sauna, were they probably including people drinking alcohol during those studies in the sauna, if that's part of the normal behavior?
Well, I think, the study was done in the 80s, and it was a study that looked at cardiovascular risk, and it was a questionnaire at the same time about sauna habits, and they didn't, I haven't seen, and I don't know if they asked about alcohol as well, but since it's not uncommon that you combine, I don't know the answer, but as it was designed, I think it was combined with alcohol in some of those cases, for sure. Yeah, but yeah.
Can alcohol be dehydrating though? That's
yeah.
Heard.
That's a good question. It is actually, yeah, because you're peeing more when you're drinking alcohol. Yeah, and that's also that's why it's better to drink water, or non-alcoholic.
There's another important safety thing. I'm just going to make a quick comment. Beer or booze of any kind of alcohol, I think accidents in the sauna go up. And then the other thing, I'm not going to talk about, let the doctor talk about medical stuff, but slipping, falling, knocking stuff over, being stupid. The other thing is the sauna is burned down on a routine basis, and often there is a party going on and somebody doesn't pay attention. So if you make a list of all the reasons not to drink while you're doing a sauna, the list gets pretty long. And I wanted to mention the fire part. I built these things for a living, and I've replaced a couple of burned down ones. So it's like anything else. Moderation, is a good thing. Thank you, and great talk. Appreciate it.
Thank you, and I agree. Moderation is the word.
Then there's a question, any contradiction for folks with solid organ transplant, or if they are immunocompromised?
Well, that's a good question as well. One of my closest friends is a transplant surgeon, and I asked them, what do you tell your patients? And actually, there is no contraindication. What they say is that you should avoid sauna for directly after a couple of weeks after the transplant, but it was not clear what in his answer why. But you can continue sauna bathing even though you are a solid organ transplant patient.
Then Monica is making a statement. This was very informative. As with all modalities that treat the whole human being, sauna seems to be not only a medicinal and cultural practice, but a spiritual one. Thank you for promoting preventive medicine.
Yeah, and I can see here in the chat also that there's someone comment on the sweat lodge. I mean, the Native Americans have been bathing sauna for also, so, and it has been used in different traditions as well.
Risto Eloma, are you still online? You are talking about good sauna temperatures. There's two Risto Eloma and Risto Sibula. Is there going to be a sauna war about temperature?
I don't think so, and we know each other, so that's no problem. But I mean, talking about these research results, so especially everything that has been done at Jari Laukkanen's group, so they have been done in a real Finnish sauna, where let's say the lowest temperature is around 70 degrees C, and between 70 and 95 degrees C. So, and here is a question has somewhere written that the hot bath, can it give the same results? Well, there are no reports about that, but I mean, the hot bath is normally maximum about 40 degrees C. So the question is is that giving high enough core temperature? Then that might be something that Hans does know. But I mean, the whole thing here is that the temperature has to be reasonable high in the sauna, and humidity also correct. Then we can say that these results, which have Jari Laukkanen, for example, has been publishing, they are correct because they are based on this kind of sauna. So, for example, if we are talking about infrared cabins, they are not giving the similar effect than a real sauna.
Thank you, Risto. And then Arnold Alanen is asking, is there any explanation for the lower average lifespan of Finnish men when compared to Swedes and Norwegians? Perhaps the difference would be greater if Finns didn't have the sauna.
It might be so, yeah.
I can say here that we are using quite a lot of alcohol in the sauna.
Yeah.
So that takes us down. Okay, let me see. Any other live questions coming through?
If we're done, I'd like to just ask a follow-up here.
Go ahead.
Doctor, when you mentioned the cold baths, I was a little bit confused. Does that imply that you take a sauna and then a cold bath afterwards, or is it just a cold bath therapy? I wasn't sure what the.
Oh, no, I'm sorry. You're a good question. The cold bath houses in Sweden are combined with saunas. So usually you go into the sauna and then out in the lake or in the sea. But the trend now in Sweden is that a lot of people, younger people, they are doing cold bath without sauna. So biking to work, even though it's 10 minus and frozen lakes, they actually make the holes in the ice, and they jump into the water, and this has become very popular actually without sauna. But the cold bath houses, they have sauna.
Okay, thank you for clarifying that. I wasn't sure what you were talking about.
If I could jump in and make a quick comment about that, I live part of the year in Germany. I'm in Bonn at the moment, and thalassotherapy, seawater therapy, is quite popular here at the spa places like up on the North Sea coast. They do this in the middle of the winter when the water temperature is quite cold, and they do that without the sauna component. So it's not a cooling after a sauna session, which the Germans also do, but this is a separate thing as part of their of this alternative medical and preventative care that they practice, which is also quite interesting. I'm not sure if there's evidence-based data to support its effectiveness, but it is something that's routinely done here.
Yeah.
Thank you, Hans. This has been wonderful. Any last questions coming in? Now you have a final moment, final chance to ask anything. Otherwise, it's midnight for Hans in Sweden. So
thank you very much for this, for listening. It was a pleasure to discuss, and very good questions.
Excellent. Thank you so much for agreeing to this. And I know that the other people have already asked you for you to speak in the next festival or sauna, whatever seminar. But hey, it's good to spread the word.